Okay, it's Dr. Buford. We're just getting started on your right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. Right now we're looking at two cannulas coming in the shoulder. The cannula on the right has a shaver coming in. In between the two is your biceps tendon, and this is a normal looking tendon as we look as it exits the shoulder, but as we look down, we can see where this is torn. And this is what a slap lesion looks like. And so we're going to go ahead and actually, it looks like we'll be able to repair this back to the bone. I know we talked about the options and the different ways to repair this, but this actually is a real clean cut, and that's actually encouraging that we can repair this right back to the bone here. So what we're doing now is taking off the articular cartilage. And we're almost done with that. We'll look in there. If you want to see some exposed bone, we're just about getting there. Okay, we'll look in there again. That's looking a lot better. See that there? And now we'll look back here and see. Okay, that's like a pretty good area there. Now we're going to take an instrument called a punch, and we're going to make a little starter hole in the bone for our suture anchor. Here's the punch coming down. We're going to place this right in front of the biceps tendon, right about here. Focus, please. And then into that hole, we're going to pass a metal suture anchor, which you'll see right here. And then once we have that buried deep enough, we'll go ahead and unload the screwdriver, and we'll remove it, and you'll see two different colored sutures there. We'll give a tug, make sure it's solid. It feels very solid. Which is, what, say that again? Okay, so we're going to be tying the blue and white sutures first, so we'll take these three out of the way, and we'll take them over a switching stick and take them outside the cannula here. Okay. And then we'll take the one suture we'd like to work with first, so it's inside the cannula, just like that. And now we're going to take an instrument called the suture hook. You're going to see that come in on the right side, on the left side of the screen, rather. There it is. There it's loaded with a black wire called the super shuttle. And we're going to pass this just behind the biceps, like that. And you can see where it sneaks out over here. We'll feed a bunch of that into the joint. And then we'll take a pincher tool and we'll reach in and retrieve this. Okay, so outside your shoulder, we'll load that. And then when we pull back, it's going to bring that blue and white suture underneath, just like that. And so now, in order to complete that stitch, you have to get the other partner suture. Here it is right here. And then to save ourselves a step, we're going to take one of the other white sutures out now so that it's ready to pass in just a minute. Okay, so now we've got that ready to go. Let's tie a knot. Okay, so now we're going to tie our first knot in this blue and white suture. as you pull tight, that's going to snug down this part of the, pull back and look down. No, rotate the other way like you were. Just pull back a little bit. Yep, perfect. Okay, so that looks really good. Just want to confirm. Pause, please. Okay, now we're cutting the suture tails, and that's the end of the first stitch. And now we're going to come over here on the other side of the biceps, the right side of the biceps here, and do the same thing. So here's our suture hook coming down, and we'll start this down here. And we'll get a little bit deeper and cheat through right about there. It's a good spot. And then here we'll take our pincher tool and retrieve the relay. It's dark in the back, isn't it? Okay, so now we've got that suture passed. We'll tie this knot just like we did on the other one. We'll show you some more in just a minute. Pause, please. Okay, so we're all done with the slap repair. You can see the biceps. It's anchored down now. There's a stitch on either side, and that looks pretty good. As we look down the front of the shoulder, we can use our shaver just to smooth out any rough areas that we come across, like right here. We'll look down here. Labrum's a bit frayed, isn't it? But there wasn't any instability on exam, so we're not going to worry about that. That's what we call a meniscoid labrum. Okay. That looks pretty good. And as we look up at the rotator cuff here, at the top of the screen, the rotator cuff's right, and that looks just great. So we're going to go look up. There might be. Okay, finish off a little bit of a bone spur from the undersurface of the bone called the acromion. We've already done a little bit of work, but now we're just going to complete the job by taking off this anterior lip. Okay, you can see how much bone we're removing there. And we'll get this finished up and show you some more in just a minute. Pause. Okay, so now we're just going to take a look down at the rotator cuff, make sure it's okay on this side. As we pull back and look towards the front, that tendon's checking out just fine there. That's good news. This is kind of the mid portion of it, directly beneath the shaver. And then this is the posterior aspect, and that tendon looks uninjured, so that's good news. So we're going to finish up here shortly and get you back to the recovery room. I really hope this does the trick for you, okay? Good luck to you now. Bye-bye.